Do you ever wonder why your period stopped before age 40? Or why you feel unusually tired and emotional? That could be a sign of primary ovarian insufficiency, POI, sometimes called premature ovarian failure. Think of your ovaries like a pair of tiny factories that make eggs and hormones. In POI, these factories start working poorly much earlier than expected, which can change your menstrual cycle and affect how you feel day to day. Let us explore what this means in simple terms. What could make the ovarian factories stop early? Several things can be behind POI. Genetic factors. Some women inherit a gene that makes ovaries age faster. For example, Turner syndrome, Fragile X-associated POI. Autoimmune attacks. The body's immune system may mistakenly target ovarian tissue, similar to how it can attack the thyroid. Medical treatments, chemo, radiation, or surgery that removes part of the ovary can damage the egg supply. Infections or toxins. Certain viruses or chemicals can harm ovarian cells. Unknown, idiopathic. In many cases, doctors can't find a clear cause, which is why it's called idiopathic. Think of it like a car that stops running early because of a faulty engine part, a bad fuel line, or simply an unknown defect. Explanation. How might POI show up in your daily life? Here are common clues. Irregular or absent periods. Missing periods for 3 months or more before age 40. Hot flashes or night sweats, similar to menopause symptoms. Difficulty getting pregnant. Fewer eggs are available. Mood swings, anxiety or depression. Hormone changes affect brain chemistry. Dry skin, thinning hair or vaginal dryness. Low estrogen levels. Imagine you're a garden that suddenly gets less water. The plants your body's systems start looking wilted. If you notice several of these signs, it's worth talking to a health professional. Blood tests measure hormone levels high follicle stimulating, hormone FSH, and low estrogen suggest POI. Ultrasound looks at the size of the ovaries and counts visible follicles. Genetic testing checks for known chromosome abnormalities. Treatment options focus on 3 goals. Number 1, replace missing hormones low-dose estrogen progestin pills, patches, or gels keep bone health strong and reduce hot flashes. Number 2, fertility support IVF with donor eggs, or in some cases using any remaining own eggs. Number 3, support overall health calcium and vitamin D, regular exercise, and counseling for emotional well-being. Think of hormone therapy as adding back the missing fuel so the body runs smoothly again. Explanation. Can POI be prevented? Because many causes are genetic or unavoidable, complete prevention isn't always possible. However, you can lower some risk factors. Avoid smoking. It speeds up ovarian aging. Limit exposure to chemotherapy or radiation when possible. And discuss fertility, preserving options with your doctor beforehand. Maintain a healthy lifestyle, balanced diet, regular exercise, and adequate sleep support overall reproductive health. Early checkups. If you have a family history of POI or related genetic conditions, see a doctor for screening. These steps are like caring for a plant. Good soil, water, and sunlight give it the best chance to thrive. Scientists are making progress. Genetic discoveries. More genes linked to POI are being identified, helping doctors offer personalized risk assessments. Stem cell and ovarian tissue freezing. Early trials suggest that preserving ovarian tissue before cancer treatment may restore function later. New hormone formulations. Transdermal patches that deliver steady estrogen levels are being studied for better safety profiles. Immunotherapy. Research on modulating the immune system in autoimmune-related POI shows promise, though it is still experimental. These advances are like upgrading a toolkit. Each new tool gives doctors more ways to protect or restore ovarian health.